Critics of proposed cuts to the National Institutes of Health say it'll drastically impact universities in mid-Michigan that study breast cancer and other diseases.
A Michigan State University professor is concerned that a loss of funding will also mean a loss of lives.
Taryn Simmons spoke with that professor and a breast cancer survivor. She joins us now live in the studio with what she found out. Good evening, Taryn.
Siobhan Jorma, I spoke to an associate professor, Jamie Bernard, first back in April, and then again today. She says money of her research funding has been cut and the grants have been frozen, and she's not the only one concerned.
This is my third chemotherapy treatment called AC.
After her 39th birthday, Nadia Zueta says she found a lump on her breast and immediately told her doctor.
So I had a biopsy, and unfortunately, not only did I have breast cancer, but they told me that I had probably one of the most aggressive and rare types called a metaplastic breast cancer. My cancer was actually linked to my exposure at the World Trade Center. At the time of 9/11, I was taking classes that involved me going to the ground zero, interviewing a lot of survivors.
Zueta says she went through a year and a half of aggressive chemo treatment and surgeries.
Was put on oral chemo called Xeloda, which caused my hands and feet to bleed. I lost my fingerprints.
Zueta's aggressive breast cancer is what pushes MSU Associate Professor Jamie Bernard to fight against proposed cuts to the National Institutes of Health.
There's also proposed 1/3 cuts to 40% cuts of all NIH spending, and that will seriously damage the research here at Michigan State University. The federal funding that keeps the lights on in the lab, that allows us to do our work and hire our graduate and PhD students. We can't do that without federal support.
Bernard says the research to help treat breast cancer is done at universities with the help of federal funds. And without that money, she says there won't be many treatment options for patients.
It's going to lead to increased costs and people dying. You're also going to lose your healthcare workforce as well, which will also increase costs.
And for cancer survivor like Zieta,
having had a very rare type of breast cancer where there's no real standard of care, research really is what is guiding future care.
Bernard also adds that proposed cuts to the NIH's budget could lead to her labs and many others closing their doors in the next 5 years. Siobhan and Jorma, back to you.